Born on the 4th of July focuses on the story of an awestruck 10-year-old boy named Ron Kovic that wanted to enlist in the Marines after seeing the veterans march in a parade on the 4th of July, which was also his birthday. He decided he wanted to fight for his country, something that would make his mother and father proud of him and would fulfill his own personal goals. Unfortunately for him, he was sent to fight in Vietnam and was injured there, eventually being sent home after spending weeks in a hospital overseas with horrid conditions and rather careless medical attention. He returned home to the United States, which had divided opinions about the war in Vietnam, with both physical and psychological damages. Most notably, he suffered from post-traumatic stress disorder, commonly referred to as PTSD. PTSD is classified in the DSM-5 as an anxiety disorder that develops in some who have experienced a shocking, scary, horrid, or extremely dangerous event and have trouble coping with it. Due to the shocking and horrid conditions often associated with warfare, veterans are much more likely to experience PTSD than the average citizen, and veterans with PTSD often don't receive the treatment they need, either because of shame for not being able to handle the stressor or because the family does not realize that their loved one needs professional psychological help. Symptoms of PTSD can show themselves as early as a few months after the event, but can also appear up to years following the event. To be considered PTSD, the symptoms must last at least a month and impair daily functioning and relationships with others. According to the DSM-5, the diagnostic criteria of PTSD may include some of the following: a direct experience of the traumatic event, witnessing a traumatic event occur to others, or learning of a traumatic event that occurred. Recurrent distressing memories, dreams, or flashbacks of the traumatic event that occur causing serious psychological distress. The avoidance of external stimuli that would remind one of the traumatic event. Negative beliefs and expectations of oneself or the world in addition to a persistent negative emotional state. A noticeable diminished interest in activities and feelings of detachment or estrangement from others, as well as distorted cognitions about the cause of the event, which is often associated with misplaced blame. These feelings often lead to emotional outbursts of anger and rage, and finally, participation in reckless and self-destructive behaviors. While not all of the symptoms may be present in every person that experiences PTSD, many of the listed symptoms are common. The symptoms of PTSD can be treated with therapies, medications, or both. Most commonly, antidepressants are prescribed to control feelings of helplessness, worry, and sadness associated with PTSD. Psychotherapy, also known as talk therapy, is also used to combat PTSD. This type of therapy involves a one-on-one or a group setting where the affected person talks about their trauma to a psychological professional, and then therapies can be adjusted based on each person's individual needs. While Ron was in Vietnam, he experienced many horrifying events, but the one that triggered his PTSD was the accidental shooting of a fellow Marine, Wilson, after a confusing ambush of a civilian town where he left a baby crying in the arms of its dead mother. This event greatly disturbed him, as can be seen immediately after it occurred and upon his return to the States. On the next 4th of July, Ron was asked to make a speech to the crowd regarding the men that were serving in Vietnam. He heard a baby cry in the crowd, which triggered his memories of the war, and he froze on stage, having flashbacks to his time in the Vietnamese village where he killed his friend. His symptoms of PTSD can also be seen in his own home. In one scene, he screams at his own mother in a fit of rage, claiming that God must be dead if he allowed such a horrible thing to happen to him. He mentions feeling helpless and how worried he is that nobody will ever love him because he's not a whole person. His self-esteem plummeted by this point, which is a major symptom of PTSD. Shortly after this occurrence, he traveled to Mexico to escape everything, and he coped using alcohol and prostitutes, examples of self-destructive behavior. Even while in Mexico trying to escape reality, he suffered from nightmares about that one day and still did not have a positive outlook on life. He also felt guilty about that day and even found himself back at the home of Wilson's parents to confess to everything that he had done. Overall, the movie did a very good job portraying the symptoms and behaviors associated with PTSD, especially in war veterans. However, the movie showed Ron embracing discussions and protests about the war, not avoiding them, which would have been more common. The movie also never mentioned how long the symptoms were present, making it a bit harder to judge if the symptoms had lasted longer than a month, making his disorder officially classified as PTSD. Finally, the movie also gave very little insight to treatment options that Ron would be able to use to get over his PTSD. By the end of the movie, he had mostly recovered, but the viewer was not able to view his recovery process.